Welcome back to a special edition of DBL, where we are dedicating today's show to medicine in America. And of course, we have to bring in our very own Dr. Payal Kohli to talk all about this topic. Dr. Kohli, thank you so much for being here.
Actually, I want to applaud you guys today, because bringing this up is an incredible service I think you are doing to DBL Nation, to every one of my patients, and thank you for doing so, because I think this is something we don't talk about enough.
I agree. Life-saving episode, absolutely. All right, I have a very personal relationship with today's topic. My mom, Judy, we love you. She has Gaucher's disease, okay? She was misdiagnosed for 11 years. So from 1971 to 1982, completely misdiagnosed. She was eventually told it was in her head, very similar to the guest we already had. What do I say to a doctor who tells me to my face, your pain is not real? What do I say?
You know, Tori, your mom is in a really tough situation because she had a really rare condition.
Yeah.
And she's a woman. And we know that the combination of those two things makes it very likely for doctors, healthcare system in general, to mistreat, to misdiagnose these types of patients. But here's the problem. Like, you know, you have to try to understand that doctors read about diseases, patients live those diseases. And so I, as a person, use all the clues that I have, the physical exam, the history, what you're telling me, what I observe, to come to my best conclusion of what might be the diagnosis. But that's not 100% correct. And the patient is really the captain of the ship, and they just have to basically take control of that. So what I like to say is, like, if a patient comes into my office and says, I'm tired, that's a common complaint, right? I'll say, well, I'm tired too. However, if they come in and tell me details and say, I can't get out of bed some days, I can't, you know, even have the energy to take a shower or cook my dinner, that's a whole different level. It puts it in context for me. If they come in with a loved one or partner who says they're a different person now because of their fatigue, that puts it in a
debilitating me.
Yeah, so I think try to give them as many clues as you can about your condition. And if they're being flippant or, you know, blowing you off, then you need to address it with them.
So why might some doctors be gaslighting their patients?
You know, I hate that word because it suggests malicious intent, but I think I would rather call it medical ignorance, because that's what it is. They do it sort of unintentionally, and I think it's for a number of different reasons. One is, you know, we've got 5 minutes with a patient. We're being pressed by the system to see somebody every 5 minutes. So you come in and say, I have shortness of breath and I have cough. I'm going to put you in the pneumonia box, because we've been told in medical school, when you hear hoofbeats, you think horses, not zebras. I'm not going to think lung cancer. I'm going to think pneumonia. So part of it is, you know, that they're pressed for time. They try to see common things are common. But part of it is that they bring in their own cultural biases into what the visit is. So if I come in there and, you know, somebody complains of pain, my own pain threshold could determine, how I think about that person. Sometimes I bring in a diagnostic bias. So if yesterday I saw a patient who had a specific diagnosis, they came in with headaches and turned out to be a brain tumor, well, guess what? I'm more likely to think about a brain tumor. So a lot of this is unconscious, but you really need to sort of, as a patient, make sure that you're getting the care that you deserve.
Wow, so much information.
Yeah.
But we're going to have more with Dr. Kohli.
Yes.
Thank you so much, Dr. Kohli and DBL Nation. Check out Dr. Kohli's podcast, Heart of Medicine, and we will hear more from her throughout the show.
Absolutely.
We'll be right back.
I wanted to ask you a question. Can I talk to you about this?
Please.
Okay, so I want to give some tips, like hacks, because sometimes it's overwhelming. If you are with an older patient or a mom or a grandparent, isn't it better to take someone with you to take notes? And B, how do you feel if I ask to record the discussion?
Oh, I'm so glad you asked me
Because that's my new thing with my dad and mom.
Yes.
Neurologically, it's easier to just have a recording.
Yes, I love the idea of having a recording in my visit. Number one, patients forget a lot of what I tell them.
Right.
So having a recording means they can refer back to it later. Number two, I talk a little more clearly when I know I'm being recorded.
Oh,
because
interesting.
I know that it's something they might reference back to later,
never
as
thought
opposed to
about
sort
that.
of talking in circles. And then number three, I think for you as a family member, if you're not present in the visit, you have other family members who may want to hear what happened during that visit.
Right.
Having a recording is really important. In addition to taking notes during the visit, though, Tori, if you go with an older grandparent, having a list of their medications, knowing
Smart.
what they're taking.
Smart.
Because the doctor can't change things
If they don't know.
what you're
Yeah,
taking.
have it printed. We have it in my mom's car all the time. Yeah,
Right.
just have it printed out.
But actually, sometimes people even bring in the pill bottles.
Smart.
Because they're like, well, I take this one in the morning, I take this one at night. Because sometimes I'll say, well, when are you taking it? And I'm like, oh, I
have
don't
no
know.
idea.
It's the blue pill.
Right.
I don't know what that is. you
Right.
know?
There's something else too I wanted to ask you about. This is all about just life hacks and communicating. My mom can't hear well. She has hearing aids. She's also short and is in a wheelchair a lot of the time. The doctors talk like this to my dad, to me, and she's down here and can't hear. And I always say, could you lean down and speak to her and slowly, because she is ignored. Is that rude?
No, it's necessary. And it's funny because when I come with a family member, I always take my mask off if they're hard of hearing.
Yes,
because then it helps to see. And I talk to the patient.
It's so different.
Yeah.
So
really
just
important.
advocate for that. It can really change the vibe in the room. Thank you so much, Doctor. Bye, guys.
Welcome back. 72% of people who participated in a recent study admit to feeling dismissed by their doctors. And Dr. Kohli's back to break down what you can do if this is something that you are experiencing at home. So please, Dr. Kohli, thank you for joining us again. We have so many questions. This has been an eye-opening episode.
Yeah, the audience is really responding here. After hearing our last guest story, and second opinions. When do you get it? How do you do it? Is it awkward? Should you do it? Talk to us.
Never awkward. A second opinion can never get you in trouble, but don't pull that lever too early, I would say. So first talk to your doctor, give him a chance. Because when I meet a patient, try to assess how much knowledge and information I should give them, how much I should listen, and then I come to my diagnosis. Now, some patients will come back to me and say, nope, that's not enough. I need more. And I need to hear that as a physician in order to say, okay, this is somebody I need to spend a little longer with.
Okay.
This is somebody I need to dive deeper into. They're adding more information to what my history is that maybe I hadn't gotten the first time around. So give them a chance to make it better before you throw the baby out with the bathwater. Second, assess the limits of their knowledge, guys, because now medicine has become so sub-specialized. If you came to me with back pain as a cardiologist, what would I do? I would rule out a heart attack, a tear in your aorta, a bad infection around your heart, all the heart-related stuff.
Right.
But if you've got something in your spine, that's not my specialty. Mm-hmm. So if that particular doctor you feel like has kind of hit the edge of their limits, it's time to move on to someone else. And I do second opinions all the time. Sometimes I'll just tweak something a little different on my second opinion. And so you have to remember that medicine is as much of an art as it is a science. And so one doctor, based on their personality, their approach, how aggressive they are, may recommend something a little different than somebody else.
Wow. Well, let's talk about another part of this equation, because of the internet, a lot of people are self-diagnosing. I remember when I was in my early 20s without health insurance, I went on to a website and I was convinced I was dying, but it was just the taste buds on my tongue. So let's remind our viewers why they should trust doctors too.
You know how I think about medicine? In the perfect world, the perfect doctor's visit would be the intersection of the patient and their history with the doctor and their medical knowledge. And it is perfect harmony that those two should come together. And when they fall out of balance, that's when we get in trouble. So if you think that you know more than the doctor, this is a dangerous, slippery slope. And I just had a patient just the other day who came into the office. Her blood pressure was off the charts to the level that she could have a stroke. And I said to her, it's really high. I need to do something about it. And she says, oh, it's only high when I go to the doctor's office. And I believed her. Right. But that is even a sign of disease. And that's the part of it she didn't know about. She didn't realize that, even if it just goes up when you're getting cut off on the road or when you're in the doctor's,
still bad.
It's a sign of abnormal blood vessel reactivity. So I feel like trust your doctors. Make sure that you remember that they went to medical school and did training for decades, and they have something to bring to the table. But if they're not listening, that's what you need to bring to the table. Make sure that they listen.
Yeah. Can I ask you, is it ever okay to go to the internet? Like ever?
Dr. Google or Dr. Jackson? Who would you go to?
Both.
You'll notice he's not here.
Yeah, Dr. Jackson has been removed. Wait, is it ever okay to do that?
You know what I like to do? When something's outside my specialty and I'm like, oh my gosh, do I have this? I like to use the internet as a way to ask better questions at the doctor's office. So I'm not making a diagnosis. I'm still trusting my doctor to give me that information, but at least I'm walking into it sort of saying, Dr. Kohli or Dr. whoever, I'm worried about this, or I read about this. What do you think about this? So that's how I like to use the internet, sort of to do my research, to go in to my doctor and ask questions.
So arm yourself with that knowledge.
That's right.
But don't be like, it is this.
Like that?
Yeah, it is this.
You sound like me.
I know, you're cute. People write in, you sound sexy.
Oh, really?
Yeah.
Okay, don't tell my husband. Dr. Kohli, thank you so much for helping us navigate healthcare. And again, what an eye-opening episode. Check out Dr. Kohli's podcast, Heart of Medicine. We'll be right back.